Hello everyone. Welcome to the second edition of Indian Stents Get Updated. I'm Viveka Roy Chaudhary from Express Healthcare. Today, we talk to Dr. Tommaso Gori of Germany, who talks about how he finds a balance in his clinical practice as an interventional cardiologist, as a trialist, and teaching new cardiologists who are entering the profession. Dr. Tommaso Gori, thank you for speaking to Express Healthcare and for coming live on Indian Stents Get Updated. You're based in Germany and you're an interventional cardiologist and you do a lot of research. So how do you balance research with your clinical practice as an interventional cardiologist?
If I can be honest with you, I just don't balance it. I'm just jungling the whole day. I start my day usually without appointments. And then just come to work. That's what I tell my colleagues. I just see what happens. Of course, you have to be prepared all the time. You have to know what's going on. You have to know what's coming up and what's changing. You have to work a lot in the nights. It's only about hours of work, basically. There is no major talent or skill involved. It's work hours. Yeah. And very important is that people are happy, people are motivated, people become competent, even though they start young and fresh, that they keep the freshness and intensity of work, and the rest comes. Yeah. So what I tell my colleagues and my kids as well is that you have to have fun at work, like in life, do something that you like, and then the rest comes. Yeah.
Okay.
And be honest, of course.
Okay. So interventional cardiology has changed a lot, possibly also because there's been a lot more technologies and techniques in the market. So if you look at just stents, heart stents in the market, heart stents have really evolved from bare metal stents to DES and to the new generation stents. Where does a clinical cardiologist, an interventional cardiologist like yourself, get the confidence to use these new techniques and technologies in your clinical practice?
Yeah, it's a constantly shifting landscape. It's constantly shifting indications, concepts, and devices to be implanted, but also devices to decide whether a stent needs to be implanted or not. And this is probably the most important thing that we are learning continuously is which lesions and which patients we should treat and which ones not. Having said that, of course, the technology of the devices evolves constantly, not only in terms of new generations, but also in terms of new concepts, new ideas, new hypotheses. Yeah. I'm talking about bioresorbable stents, bioresorbable polymers, new drugs that are eluted by the stents, and of course, what's changing as well is the severity of the disease of the patients. We are constantly faced with progressively more complex patients and more complex disease to treat. And for this, you really need new technologies. You wouldn't be able to treat a patient with old, even drug-eluting stent technologies today.
Okay.
Yeah.
Okay. So when you say that patients are coming to you with more complex diseases, do you see a certain genetic background to these presentation of cases? Because where you practice in Germany, how diverse is the patient pool in terms of genetic background?
Yeah, it is surely less diverse than in the States, for instance. The general population is Caucasian in Germany. The focus of the mechanism of disease in Germany is more the risk factors. hypertension, and diet. Of course, we are a relatively large university center, and we do have patients that come from abroad to be treated, or of course patients that are referred with progressively more severe diseases. And it is absolutely true that there are genetic predisposition factors for disease. Yeah. I understand from the colleagues that in India the age at which patients develop coronary artery disease is progressively lower and significantly lower than it is in Europe. Yeah. And this, of course, is an additional challenge for us as interventional cardiologists, not only because we treat the first lesion, but because those patients that previously will not survive the first treatment now survive maybe until the age of 80 and then undergo maybe 10, 15, 20 interventions during their lifespan. Yeah.
Right. And you've been part of many clinical trials on the new generation stents that are coming out. What do you think of the stents that are being manufactured in countries like India? And what do you think of the data that is coming out of that trial? The second-year data was released last September.
So in terms of differences between countries where the stents are produced, of course, there is no difference yet. Now, the medicine, like everything else, is global. There is no difference in quality, in technology. I have no idea about production cost, of course, but this is not my job. I'm the physician. And no difference in competence in producing and designing the new stents. The technology specifically in terms of talent and the SMT stents, the reason why we started using them in Mainz in Germany is that I needed a stent that was easier and to deliver into the more complex lesions. And of course, I used to have another stent. Of course, we don't want to make bad advertising. I used to have another stent, and the results in terms of long-term result were not as good as with a standard new generation stent. And this is the reason why I changed. And the data of the talent study do confirm that the SMT stent, the Cruz stent, is at least at the same level as the gold standard new generation stents, probably numerically even better. There is another study now that is that focus on the outcomes in patients with high bleeding risk that cannot be treated with antiplatelet agents for longer and therefore need a safer stent. So this is also a very, very important endpoint for patients who are, as I said, progressively weaker in terms of general comorbidities, not only in terms of specific coronary artery disease.
Dr. Gori, you're also, part of your profession is also about teaching and about imparting the insights that you have gathered over the many years to the next generation of interventional cardiologists. What is the advice that you would like to give to the next generation of interventional cardiologists, your students, not just in your country, but in countries across the world?
Have fun and be honest.
Okay. Would you like to
It's two advices, but one into the other, yeah.
Okay.
Can't have fun if you're not honest.
Okay, that's a very nice note to end on. And thank you for speaking to Express Healthcare, Dr.
Thank you very much. Thank you.
Thank you. That was Dr. Thomas Gori speaking to us about why he enjoys his work as an interventional cardiologist and his advice to the next generation of cardiologists. Thank you for watching Indian Stents Get Updated, and do watch Express Healthcare site for more updates from us. Thank you.